Dr. Ken Landau. Thanks for watching. Let's talk about Clonidine, originally marketed as Catapres. This drug is used for hypertension, for attention deficit hyperactivity disorder, ADHD. It was patented in 1961, FDA approved in 1966. And although it's a pretty old drug, it's among the top 100 prescriptions written in the United States by doctors. There are going to be more than 10 million prescriptions this year for the drug. Indication is for hypertension, either by itself or with other medications. Supposedly it's useful in treatment-resistant hypertension, but usually the treatment resistance is due to lack of compliance with the other medicines that you're already taking, or you haven't reduced the amount of dietary salt, or there's some other issue. Generally, the Clonidine is not considered a first-line drug for treatment of hypertension. And as far as ADHD is concerned, it could be used as either a mono treatment by itself, or adjunctive treatment with stimulant drugs. There are a lot of off-label uses of Clonidine. So for instance, it's used for drug withdrawal from the opioids. It's used for withdrawal from alcohol or tobacco or menopausal hot flashes, even for use in women who have breast cancer or being treated with tamoxifen and have the hot flashes as a result. People who have the facial flushing, the redness of rosacea, certain psychiatric abnormalities, sleep disturbances, the hyperarousal that's associated with PTSD, post-traumatic stress disorder, or borderline personality disorder, used sometimes to treat anxiety-related conditions. It's a mild sedative, so it's even used as a preoperative prior to surgery. Again, off-label, it's used for restless leg syndrome, diabetic neuropathy. Can be used for migraines or fecal incontinence or refractory diarrhea due to the irritable bowel syndrome, or diarrhea associated with the opioid withdrawal, or certain neuroendocrine tumors, because it helps stimulate the electrolyte absorption from the intestine, changes the intestinal motility. Can be used for Tourette's syndrome and tics. Other treatments are the atypical antipsychotic drugs, but they have even more side effects. It can be used for sleep apnea. It can be used for people who have the restlessness associated with the atypical antipsychotic drugs like Zyprexa or Abilify. It can be used to counteract the stimulant effect and the insomnia that's related to the stimulant drugs in ADHD. Off-label, it can be used to treat excessive saliva due to the atypical antipsychotic, especially clozapine. It can be used for people who just drink a lot of liquid to counteract that. Psychogenic polydipsia, we call it. It can be used for alleviating the symptoms of opioid withdrawal because it decreases the fast heart rate, it counteracts the increase in the blood pressure, it decreases the sweating and reduces the hot and cold flashes. And it tamps down the general restlessness. Possibly even can be used for the neonatal abstinence syndrome of babies who were born to women who are addicted to the opioids. And although it helps to come off of cigarettes, helps you discontinue cigarette smoking, it's really not a first-line drug. Second line to nicotine replacement or to bupropion. And it's widely investigated for the treatment of pain. It seems like it might be able to increase the analgesic or the pain-relating effects, pain-reducing effects of the opioids and local anesthetics. It can be injected into the knee joint to decrease the severity of knee pain after arthroscopic surgery. And it's FDA approved as an epidural injection for treatment of pain, especially post-operative intractable pain that doesn't go away with other therapies, or for cancer pain. And it's often compounded to be used in topical formulations for the treatment of pain. Now, it seems to work best perhaps for neuropathic pain. That's the sharp and shooting and burning pain, like in diabetic neuropathy or in post-herpetic neuropathy, the pain you get after shingles. It seems to work okay, but it's probably not a first-line drug. The drug's available as a tablet or as a transdermal therapeutic system. That just means a patch. Or it's used as an extended release form for ADHD, for the attention deficit hyperactivity disorder. And both the tablets and the patch, they're available in 0.1 and 0.2 and 0.3 milligram dosages. How does it work? Well, it seems to stimulate certain receptors in the brain, and those receptors then, in fact, decrease the outflow from the sympathetic nervous system, and that means that it's going to decrease the peripheral vascular resistance, so the heart doesn't have to pump against so much resistance. It decreases the renal vascular resistance, decreases the heart rate, decreases the blood pressure, but it doesn't seem to change the flow of blood going to the kidney, doesn't change the kidney's filtration, and seems to leave the postural reflexes intact. So when you stand up, you don't get that sensation you're about ready to pass out. Seems to also decrease the amount of renin and aldosterone and norepinephrine or noradrenaline. Seems to work in pain differently than it does in lowering the blood pressure. Seems to work on the fast receptor sodium channels. If we're talking about treating high blood pressure, the dose typically of the pills is 0.1 milligram twice a day. The elderly can take it somewhat less. Increase the amount every week or so if necessary. Larger portion of the dose should be at night. Therapeutic range is somewhere between 0.2 milligrams and 0.6 milligrams a day. Some patients have significant slowing of the heart rate, but they don't have a change in the hemodynamic response to exercise. So if you exercise, your heart rate's still going to go up some. It seems that initially, at least, it might lead to an increase in the growth hormone level, but over a period of time, that comes back down to normal. The immediate release has a rapid decrease in your blood pressure within 30 to 60 minutes, maximum decrease in the blood pressure. It's going to occur somewhere between about 2 and 4 hours. Some people are going to become tolerant to its effect over a period of time. Now for ADHD, for attention deficit hyperactivity, it was approved on the basis of several short-term studies, actually 2 trials lasting for 8 weeks each, and 1 trial, a withdrawal trial, lasting 40 weeks. It was based on a previous edition of the American Psychiatric Diagnostic and Statistical Manual. We call it the DSM-4. According to the DSM-4, you had to have the onset of symptoms before age 7. Now it's before age 12. You have to have clinically significant impairment in your social or your academic or occupational function. Have to have it at least in 2 settings, at school, at work, at home. Have to have the diagnosis, not just based on the criteria of the DSM, but you have to have clinical observation. Now, inattention, according to the DSM-4, meant you had to have at least 6 of the following symptoms. The lack of attention to detail, careless mistakes, lack of sustained attention, poor listener, poor organization, fail to follow through on your tasks, avoid tasks that require sustained mental attention or easily distracted, forgetful, lose things. So you pick 6 of those, and if you make 6 of those, then theoretically you have the diagnosis of the inattentive form. The hyperactive or impulsive form, you have to have at least 6 of the following. Maybe squirming or fidgeting. You leave your seat, inappropriately running around or climbing, difficulty with a quiet environment, quiet activities, seem to be on the go all the time, excessively talk or blurt out answers or can't wait for your turn. Well, if you make the criteria and you have clinical observation both by the parent and the teacher and the doctor, then it may improve some people with ADHD. But there are a lot of side effects for relatively modest benefit, and it's not really as effective as either Ritalin, methylphenidate. In Australia, it's accepted as therapy, but it's not really approved, so you don't get the government backing. Though it's thought to affect some of the receptors in the brain, seems to work on the prefrontal cortex. We're not exactly sure how it really works. Clonidine is not as effective, as I say, as methylphenidate or the dextroamphetamine, and it seems to be better in the home setting than in the school setting. And it's better as an adjunctive therapy, especially for people who have jittery behavior, or irritability, or tics, or insomnia, oftentimes due to either taking the dextroamphetamine or the methylphenidate. Those are stimulants, Now, the American Academy of Sleep Medicine says that they really recommend behavioral therapy as the first option if you have sleep difficulty, not taking the pills. Now, according to the American Academy of Pediatrics, you can use either the immediate release form, take that up to 4 times a day, but basically no more than 0.2 milligrams at a time. They prefer, however, the extended release form. Take that twice a day. Begin with a dose of 0.1 milligrams at night. Do that for a week. Then, if necessary, can increase by 0.1 milligrams per week. Generally, the dose twice a day. It appears that the 0.2 milligrams is about as good as the 0.4 milligrams. You don't get any better if you take a higher quantity. And usually, as I say, it's added to the stimulant. It's not used as a primary therapy. Now, in attention deficit hyperactivity disorder, when we give it to children, the blood pressure does fall somewhat. The top number, the systolic pressure, falls by about 4 to 9 millimeters of mercury. The bottom number, the diastolic, falls by about 4 to 7 millimeters of mercury. And the heart rate is going to go down by about 4 to 8 beats per minute. If a person's hypersensitive to any of the elements, shouldn't take the medicine. Side effects are relatively common, but mostly they're mild and they tend to decrease over a period of time. So you get a dry mouth, dry throat, 40% of the time. Drowsiness, about 1 person in 3. And fatigue. And to a somewhat lesser extent, you have a headache or sedation or lethargy. And some people are going to complain, paradoxically, of insomnia. About 1 in 6 complains of dizziness, may lead to erectile dysfunction, sexual dysfunction, constipation in 1 person out of 10. Can lead to some nausea or altered taste or nervousness. And even lead to too much reduction in the blood pressure. Can lead to an accommodation error in your vision. And that might mean that driving or operating heavy machinery can be difficult, cause dry eyes. That's a problem if you happen to have cataracts. And if you use the patch on your skin, may lead to an irritant dermatitis in about 50% of the people with some redness and itching at the site of application. That's more common than a contact dermatitis, but it's so bad that some people can have moderate to severe localized redness or blistering that occurs at the site of application. Some people even get a generalized rash, some burning and swelling. Hives may occur even after you've been using the medicine for anywhere between a month and a half and half a year. You can still develop the hives, and some people develop a contact dermatitis. Seems that the contact dermatitis occurs more often in the Caucasian population, about 30% of Caucasian women, 18% of Caucasian men. In the African American community, only about 14%, so half as much in the black women, and 8%, or again about half as much as in the Caucasian men. Well, other side effects include fever or malaise or palpitations or anorexia, loss of appetite or vomiting or difficult time urinating, sometimes even enlargement of the male breast or leg cramps or nightmares or restlessness, and perhaps more importantly, can cause some electrocardiographic abnormalities, some arrhythmias and some chest pain. Now in animals, if they were given the medicine while they were taking amitriptyline or Elavil, that's a tricyclic antidepressant, well, within 5 days, a significant portion developed corneal lesions, lesions on the outside of the eye. And as a matter of fact, there was a significant degeneration, spontaneous degeneration, of the retina in animals who were given the medicine for more than 6 months. Now in humans, looking at more than 900 people, the only complication in the eye is dryness without any other ophthalmologic abnormality. There was certainly no change in retinal function, just something to put in the back of your mind. Now, you don't have to discontinue the drug if you're going to have surgery, but if you're going to have defibrillation or cardioversion, because maybe you have atrial fibrillation, well, you should remove the patch so that you don't get any arcing and then a skin burn. And the same thing, if you're going to have an MRI, you should take the patch off. It doesn't matter if you're taking the pill, but if you use the patch, you should take it off because it has some aluminum in it. You could overdose on the medicine. If you overdose on the medicine, your blood pressure will go down, obviously. Your heart rate will slow. You can have some respiratory distress. The temperature can go down. You can feel drowsy, have decreased or absent reflexes, and you feel weak and irritable. You can have some central nervous system depression, although that's more common in children than it is in adults. You can have some reversible cardiac conduction abnormalities, dysrhythmias, arrhythmias. You can suffer from apnea or coma or even seizures with overdoses. The onset of those symptoms, if you overdose, somewhere between 30 minutes and 2 hours. Children, toxicity can occur with as little as 0.1 milligram. There's no specific antidote if you overdose, although if the heart rate gets too slow, we can use an injection of some atropine. We can use fluid to counteract the hypotension. And sometimes if there's respiratory depression, then we could use naloxone. If you're taking the medicine over a period of time and you suddenly discontinue it, then you could have some nervousness or agitation or headache or tremor. Some people become confused, and you can have a rapid increase in the blood pressure. Now, that's less likely if you use the patch, because the patch slowly allows the blood concentration to decrease. Well, if you withdraw from the medicine, you probably want to do it relatively slowly. You want to reduce the amount you're taking by about 0.1 milligram every 3 days to a week. For some people, even doing that, you can get an increase in the heart rate and a warm feeling, a flushing feeling, lightheaded, complain of chest tightness or some anxiety. Withdrawal symptoms more likely after you've taken a high dose than a low dose. And if you happen to be also taking a beta blocker, a drug like propranolol or Inderal or atenolol or metoprolol, well, if you're taking one of those drugs, then you ought to stop it a while before you start to discontinue the Clonidine. Otherwise, you get some of those withdrawal reactions. Now, it seems that the immediate release and the extended release form have different pharmacokinetic properties. The body handles them differently. You can't substitute the exact same milligram of the immediate release for the extended release. It seems like the blood concentration of the extended release is about 50% lower than the immediate release. And remember, the extended release is principally used for attention deficit hyperactivity disorder. If you're taking the pill, you don't crush it or chew it or break the pill apart. While you're taking it, because of the way it works in the body, you want to avoid overheating and you want to avoid dehydration, especially if you happen to be at risk for fainting, because it might make your blood pressure go down, it might make your heart rate go down. If you're taking the immediate release, the peak concentration is going to be about 3 to 5 hours. The half-life is going to be between 12 and 16 hours. But if you have severe renal function abnormalities, the half-life can be extended to about 40 hours. About half of it goes out because of liver metabolism, and the other half goes out unchanged in the urine after a period of about 24 hours. Now, the extended release, as I said, the maximum concentration in the bloodstream is going to be about 50% less. The peak blood concentration is going to be about 5 hours delayed compared to the immediate release form. Similar elimination half-life. If you're taking the medicine, you want to titrate relatively slowly, increase slowly, while watching for signs of hypotension, low blood pressure, or heart block. Watch for slow heart rate, especially in people who have cardiovascular disease or cerebrovascular disease or renal failure or history of syncope. If we're talking about the patch seems to release a constant amount of medicine over a period of a week. However, once you put the patch on, it takes about 2 to 3 days in order for it to get up to a significant enough level so that it can reduce the blood pressure. Well, if you're starting off with the patch, you start with the 0.1. Then after a week, if your blood pressure isn't well controlled, you can add another 0.1. The maximum dose would be 2 of the called TTS3. That means each patch contains 0.3 milligrams of Clonidine. So the maximum dose would still be the same, 0.6 milligrams, 2 of the TTS3. Again, remember, it takes 2 to 3 days for the medicine to start to work. So that means if you're switching from some other kind of an antihypertensive, even if you're taking the oral clonidine, you can't stop it abruptly and then put the patch on, because the patch is going to take a couple, 2, 3 days to work. So you continue the antihypertensive drug that you're going to substitute for the clonidine. You continue that for a couple days into the patch, and then you discontinue it. Well, the important thing to realize is that when you take the patch off, it still has a significant amount of medicine in it. And that could be harmful to infants or children if it's ingested. So what you do, if you're using the patch, once you take it off, you should fold it in half, sticky sides together, and then discard properly. Because a TTS1 that contains, or delivers rather, 0.1 milligrams to the skin, well, that patch contains 2.5 milligrams of the clonidine. So that means after a week, it still has a heck of a lot of clonidine left. If it happens that you've taken too many showers or there's some other reason why the patch becomes loose, well, it comes with an adhesive cover, and you just put that on top of it so it stays adherent to the skin. Now, if you develop localized skin sensitivity from the patch, you could change to the oral medicine, but if you change to the oral medicine, you might develop a generalized rash. That's an issue. And in order to make certain that you don't have worsening of either sinus node dysfunction or the presence of what we call an atrioventricular block, so that you get some kind of an arrhythmia, you want to be especially careful if an individual, if you happen to be taking doxazosin or labetalol or carvedilol. Those are very commonly used medicine for treatment of high blood pressure or heart failure or difficulty urinating, especially in older men. If you combine those medicines, you could get a severe bradycardia, severe lowering of the heart rate that might take you to the hospital to get at least temporary pacing. So be careful. And the medicine can potentiate the central nervous system depressive effects of alcohol and barbiturates and sedatives. So got to be extra careful. And if you're taking a tricyclic antidepressant, amipraline or nortriptyline, that might reduce the hypotensive effect of the clonidine. So you might need a higher dose of the clonidine. And if you're on a neuroleptic, one of those atypical antipsychotics like Zyprexa or Abilify, might lead to development of orthostatic hypotension. So when you stand up, you get very faint. Got to be extra careful if you have some sinus node dysfunction or if you have atrioventricular node conduction abnormalities. So in other words, the electrical impulses in the heart don't work really the way they're supposed to. Got to be extra careful if you take it with digitalis type preparations, digoxin or diltiazem or verapamil. That can lead to significant bradycardia problems. It seems that it crosses the placenta, so use in pregnant women only if necessary. Seems to be no special issue in humans that we know of, no issue in test animals. If a woman is breastfeeding, well, the drug is going to be in the breast milk at about 2/3 of the mother's blood level. Not well studied in children, except in the case of attention deficit hyperactivity disorder. And interestingly, the concentration of the drug in children seems to be higher than it is in adults who are being treated for hypertension. Food doesn't change the half-life or the bioavailability or the plasma concentration of the medicine. Medicine doesn't cause cancer, doesn't seem to interfere with fertility. Cost of the medicine is relatively reasonable. You can get 60 tablets of the 0.3 milligram immediate release form, cash only between $12 and $40. If you have a coupon, like you could get from GoodRx, costs $8 to $18. If you wanted the trade name, the Catapres, the same dose, the same amount, cash would cost about $400. With a coupon, somewhere around $320 to $350. If you wanted to use the patch, you could get 4 patches of the 0.2 milligrams, but that's going to cost cash between $525 and $800. And as usual, Walgreens is the highest. If you have a coupon, it's going to cost somewhere between $470 and a little over $500. And again, Walgreens is the highest. And if you happen to go for a higher dose, like the TTS3, well, that's going to cost even more. That's going to cost cash between $735 and $867. Highest again, Walgreens. And if you have a coupon, more than $650 to over $700. And again, you can be sure that it's Walgreens for the over $700. Now, if you want the form for ADHD, the extended release form, you could get the generic version. It's available in 0.1 milligram only. You could get 60 of them. Cash would be $99 to $273. Again, you know where Walgreens is. And for coupon, anywhere between $28 and $88. Now, if you want the trade name, it's called Capve. And Capve is going to cost cash somewhere in excess of $500, and it's going to be more than $450 if you get it with the coupon. So Clonidine, it's a very commonly prescribed medicine, but it's not really the first choice for any approved indication. And as with so many other drugs, it seems that it's employed when other drugs don't seem to work, when we don't seem to have anything. And oftentimes, when it's used, it doesn't provide anything either. Now, I'm not really a big fan of Clonidine. It seems like you get an awful lot of potential side effects for relatively limited upside, but still, it's among the top 100 prescription drugs in the United States. Anyway, thanks for watching. If you enjoyed the show, please tell a friend, consider subscribing so you'll be notified when we post new videos. I appreciate your interest. I'm Dr. Ken Landau.